behalf of the 337 residents, their loved ones, our amazing team of interprofessional staff members, and our vibrant volunteers, we are pleased that you could join us here today. Kipling Acres is a thriving hub for the Northern Etobicoke community with an on-site adult day program, the Kipling Early Learning and Child Care Center, and the West Acres Senior Center, which offers wellness and recreation program for local community seniors. I will now read the land acknowledgement. For Toronto, we acknowledge the land we're meeting on is a traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse nations, Inuit and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. African Ancestral Acknowledgement. The City of Toronto acknowledges all treaty people, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. I now invite and welcome Minister Stan Cho to the podium.
Well, thank you very much, Bambo, for that introduction, and good afternoon now, everyone. It's a pleasure to be here in Etobicoke, where I was born, by the way, for this very exciting announcement. I want to start by thanking the wonderful staff here at Kipling Manor for being such gracious hosts, and more importantly, for the work that you do every single day to support our amazing residents. I know Councillor Crisanti's not feeling too great this afternoon, but I want to acknowledge that his team is here and well represented. Thank you for joining us here today. You know, I promised my team on the way over I wouldn't tell this story because I've told it probably 40 or 50 times in the last 5 months since I got appointed as Minister of Long-Term Care, but I'm going to tell it anyway. The first call I actually made at my office was to my parents to let them know the exciting news. And my mom's wonderful. They're seniors now. My mom said, congratulations, it's hugely important. You have to take care of our seniors, work really hard. And then she goes, hang on, I'm going to pass the phone to your dad. My dad picked up, I told him the news, and he paused for a second, and he said, you work for me now. And I kindly reminded him he works for my mom, but you know, the more I think about what my dad said to me that first day, I realize every single day that he's absolutely right. I do work for him. I work for all of our seniors in this great province of ours, because seniors, like my parents, took care of us, and it is now our turn to take care of them. And that's why we are taking steps to improve long-term care in Ontario, make sure that residents get the quality of care that they need and that they deserve. Now, our plan to improve long-term care is built on 4 pillars. I won't spend a lot of time on them, but they are very quickly connecting seniors with faster, more convenient care and access to services that they need. That's actually what we're here to announce today. Improving staffing and care, driving quality through better accountability, enforcement, and transparency, and building modern, safe, comfortable long-term care homes for our seniors. So let's get right to it. I'm pleased to announce that the government is investing $5.5 million to create new behavioral specialized units, or BSUs, to support individuals with complex behaviors like dementia and severe cognitive impairment. Just under $2.5 million will be administered by Ontario Health for 51 new BSU beds, 17 right here at Kipling Acres in Etobicoke, 26 at Peel Manor, and 8 beds at Golden Manor in Timmins. The funding will increase staffing at these homes and provide an environment that's tailored to the needs of residents with more complex behaviors. The remaining $3+ million will fund improvements to BSU service delivery and train BSU staff in all 21 designated BSUs across the province. You know, in recent years, we've seen the profile of long-term care home residents become more complex. approximately 70% of residents have dementia diagnosis, and approximately 73% have moderate to severe cognitive impairment. This announcement is timely, as January marks Alzheimer's Awareness Month. This month and every month, we need to acknowledge the growing number of people who face this disease and how we can better serve people with complex needs and work to prevent Alzheimer's while making sure that supports are there for people living with dementia. People with complex behavioral symptoms are often more difficult to place in long-term care homes because they may exhibit aggressive behavior or agitative response behaviors to their social or physical environments, which require specialized care to support their needs. Expanding the number of BSU beds across the province will also help alternate level of care patients access the care they need in long-term care homes and avoid unnecessary long-term hospital stays. These important investments will help protect our seniors in long-term care so they can receive the quality of care that they need and they deserve. Now, building a strong and resilient long-term care sector also means that we need to improve staffing and care. And let's be very frank, I see many staff here today who do the work for our loved ones that, frankly, many of us cannot do. And I want to thank you for all your efforts here and the tireless hard work that you provide for our amazing residents. That's why we're investing $4.9 billion to support you to create thousands of new positions and supports for PSWs, RNs, RPNs who want to have a rewarding career in long-term care. The ministry now has currently over a dozen programs available to help educate, recruit, and retain PSWs and nurses in long-term care homes. So whether someone is looking to upgrade their international nursing education, launch or build a career as a resident support aide, personal support worker, or nurse, the government has a program and supports to assist qualified candidates. Just recently, we announced an incentive designed to increase the overall supply of PSWs and encourage future careers in long-term care as well as home and community care. The announcement I made a couple of weeks ago, it's retroactive for its eligibility to April 1st of last year, and it includes clinical allowances of up to $5,400 for students, waive student fees for students in district school board PSW programs, $10,000 as a PSW incentive for a one-year commitment to work in long-term care, and an additional $10,000 incentive to work in rural, remote, and northern communities for a year. This is in addition to, of course, the scale-up abilities for PSWs to become RNs, RPNs, and stay within the sector as well. As I said before, the staff do invaluable work. That's why they're building homes. You know, we call them long-term care beds, and I'm trying to get away from that because beds are furniture. To build a home, we need better outcomes, we need better tools, we need staffing like the wonderful people I'm looking at right now. And of course, as I said, seniors, they took care of us. It is now our turn to take care of them. Our government will make sure we support to do just that. Thank you very much, everyone. Thank you.
Good afternoon, everyone, and thank you, Minister Cho, for coming to Kipling Acres to make this very important announcement about our new behavioral support units. Unfortunately, the local city councillor from Etobicoke North, Vincent Crisanti, was unable to be with us today, but he too acknowledges the funding from the Ministry of Long-Term Care that makes this all possible. The City of Toronto has a diverse aging population, and as the General Manager for Senior Services and Long-Term Care, our team is committed to supporting seniors and people in long-term care to live their healthiest and most fulfilling lives possible as they age with dignity, and to support seniors in the community access programs and supports that keep them in their homes as they safely age in place with strong connections. And this spring, Beaumont Heights, a new 17-bed special care behavioral support unit, will open to provide specialized care, accommodation, services, programs, and goods for residents with heightened responsive behaviors who are unable to be safely and effectively managed in other long-term care resident home areas. People with dementia and other complex needs require innovative care models delivered by highly trained and devoted healthcare professionals. Behavioral support units are part of that innovation and how we can transform long-term care to support individuals to make that transition. On behalf of the City of Toronto, we welcome this additional funding training, and support so that we can continue to recover from the pandemic. We can continue to transform the way long-term care is delivered and provide the complex care, unique services, and emotion-centered programs that enhance quality of life, respond to individual resident needs, and support their loved ones. I now invite Minister Cho to the podium.
Well, thank you, Jennifer. And Ashley's telling me we don't have questions at the podium, which I'm happy to accept gladly. But thank you, everyone, for being here this afternoon for a great day, and we'll talk to you soon. Take care. Thanks.